Plantar fasciitis after 60, why calf stretches alone don't work, the clinical 3-week protocol. Plantar fasciitis is the most common cause of heel pain in adults over 60, affecting nearly 15% of adults in this age group. Most online protocols recommend calf stretches and ice. And most people plateau after 2 to 3 weeks. Here's why: plantar fasciitis after 60 is not just a tight calf problem. It involves the plantar fascia itself, the intrinsic foot muscles, the ankle dorsiflexion range, and frequently, a reflexology-responsive nerve sensitization pattern. Today I'm covering the evidence-based 3-week clinical protocol that addresses all 4 components. The plantar fascia is a thick band of connective tissue that runs from the calcaneus, the heel bone, to the base of each toe. Its primary function is the windlass mechanism. As you push off your toe during walking, the plantar fascia tightens around the metatarsal heads and raises the arch, creating a rigid lever for propulsion. After 60, 3 changes impair this mechanism. First, the plantar fascia loses collagen cross-linking and becomes less elastic. It tears microscopically with each step rather than stretching. Second, the intrinsic foot muscles, specifically the flexor digitorum brevis and abductor hallucis, atrophy, reducing the arch's active support. Third, ankle dorsiflexion range typically decreases, often by 20 to 30%. Forcing the plantar fascia to absorb the forces that a fully mobile ankle would normally dissipate. Standard plantar fasciitis advice: calf stretches and rest, addresses only one of these 3 components, the Achilles/gastrocnemius tightness that contributes to reduced ankle dorsiflexion. It does nothing for intrinsic muscle atrophy or for the collagen degeneration in the fascia itself. In patients over 60, research shows that protocols addressing intrinsic muscle activation and fascial loading produce significantly better outcomes than stretching alone, with measurable improvement in 3 weeks rather than the 3 to 6 months that passive treatment typically requires. Week 1 focuses on restoring ankle mobility and beginning neural sensitization management. Exercise 1, weight-bearing calf stretch on a step. Stand with the ball of your foot on the edge of a step, heel dropping below the step level. Bend the knee slightly. This targets the soleus rather than the gastrocnemius, which is the more important restriction for plantar fasciitis after 60. Hold 45 seconds. 3 times each foot, morning and evening. The bent knee position is critical, and is almost never specified in generic online advice. Exercise 2, plantar fascia intrinsic loading, the short foot exercise. Sitting, attempt to shorten your foot by drawing the ball of your foot toward your heel, without curling your toes. This activates the intrinsic arch muscles without using the extrinsic toe flexors. Hold 5 seconds. 10 repetitions. This is the most clinically supported exercise for plantar fasciitis rehabilitation and is used in every evidence-based protocol, but is almost absent from YouTube content. Week 2 adds eccentric loading and self-massage. Exercise 3, seated towel curl. Place a small towel on the floor. Use your toes to scrunch it toward you. 20 repetitions each foot. This progressively loads the intrinsic muscles under resistance. Exercise 4, plantar fascia self-massage with a frozen water bottle. Roll the arch of your foot over the frozen bottle for 3 minutes. The combination of mechanical mobilization and cold reduces inflammatory sensitization of the plantar fascia nerve supply, addressing the neurological component that standard protocols completely ignore. Week 3 introduces eccentric heel drops and proprioceptive loading. Stand with your heels on the edge of a step, both feet. Rise onto your toes. Then shift your weight to the affected foot only and slowly lower the heel below the step. 3 sets of 15 repetitions. This eccentric loading of the Achilles plantar fascia complex has the strongest evidence base of any single intervention for plantar fasciitis, producing collagen remodeling within the fascia itself, not just symptom relief. Reflexology targeting the calcaneal and lumbar zones can provide complementary pain management for plantar fasciitis. Particularly the neurogenic sensitization component that doesn't respond to structural rehabilitation alone. For patients with recalcitrant plantar fasciitis, persistent beyond 6 months, platelet-rich plasma injection into the plantar fascia origin has demonstrated significant pain reduction and structural improvement in multiple randomized controlled trials. This is now recommended as a second-line option by clinical rehabilitation guidelines. The 3-week plantar fasciitis protocol in this video addresses 4 distinct components: ankle mobility, intrinsic muscle activation, fascial loading, and neural sensitization. Complete all 3 weeks before evaluating results. Morning pain, the first steps out of bed, should reduce measurably by the end of week 2. If morning pain is completely absent after 3 weeks, maintain the short foot exercise and eccentric heel drop indefinitely as prevention. Plantar fasciitis has a 50% recurrence rate when all activity modifications are stopped.